Hi, good evening all. On behalf of Columbia Global Centers Mumbai, I would like to welcome you all to this webinar entitled Preparing Nurses for COVID-19. I would now request Dr. Ravina Agarwal, Director, Columbia Global Centers Mumbai, to please introduce our panelists and begin the session.
Hello and welcome on behalf of the Columbia Global Centers Network, a network of centers in 10 different countries of the world, including the United States. The centers facilitate the collaborative engagement of Columbia University faculty, students, and alumni with the world to enhance understanding, address global challenges, and advance knowledge. The coronavirus outbreak has stretched the healthcare system to its limits. At the front line of this overstretched healthcare system are nurses, who comprise 50% of the total health force around the world. In these challenging times, nurses are playing a critical role in health promotion and in delivering effective primary care to COVID-19 patients. There's a shortage of nurses in Asia and Africa and all over, and with limited human power, doctors and nurses in many countries now face an unprecedented workload in saving lives with a heightened risk of contagion from coronavirus. In India, where I'm speaking from, the number of COVID-19 cases has reached 30,000 and almost 1,000 people have died of it. Like many other nations, some with far greater resources, India is facing an acute shortage of gear and equipment to protect its healthcare workers from contracting the virus. Lack of personal protective equipment is just one of the many issues healthcare workers are confronted with. Hazards such as pathogen exposure, long working hours, psychological stress, fatigue, occupational burnout, and stigma are some of the other major issues that nurses and doctors are currently dealing with. In today's webinar, entitled Preparing Nurses for COVID-19, we will be looking at some of the innovative practices that were undertaken at the Columbia University School of Nursing to deal with the coronavirus pandemic. In addition to this, we will specifically address the methodology of simulation learning as a way to better equip nursing professionals to deal with this. About the Columbia University School of Nursing, this is one of the world's oldest schools and leading centers of nursing education, research, and practice. It is my pleasure to introduce to you our panelists from this prestigious institution. The first speaker will be Lorraine Frazier, who is the Dean of the Columbia University School of Nursing. She's the Mary O'Neill Mundinger Professor of Nursing and Senior Vice President of Columbia University's Irving Medical Center. Dean Frazier is an accomplished cardiovascular and genetics researcher and regarded as a pioneer in developing and promoting state-of-the-art translational research programs. She's also an national expert in biobanking. Following Dean Frazier, we will hear from Professor Jennifer Dawn, who is Assistant Dean of the Office of Global Initiatives and its PAHO WHO Collaborating Center for Advanced Practice Nursing at CUSON. And she's also the Director of Midwifery Services. And as this director, she initiated the first freestanding maternity center in an inner city in the United States in New York. She has worked in sub-Saharan African countries since 2003, helping to expand the role of nurses and midwives in primary and HIV care and initiating methods of simulation learning into the nursing curriculum. Our third speaker will be Professor Kelly Bryan. She's the Executive Director of the Simulation Center at Columbia University School of Nursing. She has over 18 years of teaching experience and 10 years of experience as a women's health nurse practitioner. Throughout her career, she has become an expert in the field of simulation through her experience with designing simulation centers and implementing simulation programs. So welcome to our panelists, and over to you, Dean Frazier, to begin.
Good afternoon around the world. We're coming to you today, as Ravina said, from New York City. That is the center in the United States for coronavirus. Today, I looked just now, we have about 150,000 cases, 41,000 people hospitalized today, and 12,000 deaths. So we definitely are in the middle of a crisis and hopefully coming out of that. Columbia School of Nursing acted early. We prepared probably 2 weeks early to get ready for this crisis. And since this is a global program, I should share with you, I was at my desk reading a story that a nurse from China had published, and it was a cry for help for those nurses. And it described what they were doing, what they were up against, the marks they had on their face. I read that at my desk and I started to cry, and I thought, you know, we should be able to help, but of course we can't help. You know, we can't even go into China. And when it became evident that this would happen to New York, I immediately thought, we've got to help. We've got to be able to help with this crisis. So we did. I thought about our students, and I thought how we should be able to help with this crisis. So next slide. Yes. And so when you begin to prepare for a crisis, you think, okay, where are we today? What is our strengths? We have very strong graduate programs. All of our students are graduate students, so they're not nearly out of high school. They had already had another degree. And the majority of the students by this time of the year were really close to graduation. We had committed faculty and staff. We had to understand if we were going to help be part of the solution and help work with the hospital staff, that our faculty had to be on board with that. But we knew our graduates were well prepared. We teach them about global challenges, how to work when things are stressful. Dr. Doran does a very good job of preparing our students for challenges. And then we had established academic practice partners. We worked well with New York Presbyterian Hospital. I am on the board of where the CNOs, all of them meet every quarter and talk about hospital issues, so they knew us personally. And that was important because we had developed a trust with them. And they also knew our students and they knew our faculty. So those were the strengths. So we were, you know, when you think about going in to help, you have to understand your strengths, and we were strong. Next slide, please. We also had challenges that we didn't anticipate. When this happened, our students were a week away from spring break. That meant, and our students come from all over the United States. So with coronavirus coming, with all the, it was all over the news, I knew that when they left for spring break, they would pack up all their clothes and not come back to the end of the semester. So we had a week to engage them to be able to help with that hospital response, and the students wanted to. In the middle of this, Columbia canceled all classes and closed all the dorms. They said the students had a week to get ready out of the dorms. So we had to address that. Our clinical partners said no more students in the hospital at all. No medical students, no nursing students, no students. And if the students came in, Columbia would not let them work with any COVID positive patients. So we had a challenge because the patients in the hospital were COVID positive, and we said, well, why don't our students just work with these COVID negative patients? So we had to redesign our curriculum. In the middle of this, the faculty had to be able to teach online, not teach in person, and they had to change all that we do. We had to engage Kelly. Oh my gosh, with simulation was going to be now more important than ever, and she was on board. So we had lots of challenges. Next slide, please. So there was the response. We were able to go to CUIMC and say, you've got to keep the dorms open only for the nursing students. And they did. They said, okay, we let them know we were going to be able to help with the response to COVID. And they kept the dorms open, which was pretty amazing for our students. Everybody else had to leave. We negotiated with our hospital to allow patients to be at the clinical site. And here's how that conversation went. in 2 months or 6 weeks from now, I said, looking at what happened in China and remembering that nurse, you guys are going to need a lot of help very, very quickly. I had been a hospital in hospital administration, and I knew that that was going to be a big problem. So we had to really let the hospital know that our students were so talented that they would be helpful to them. They were only going to work with non-COVID, but by the time we moved forward, everybody had COVID at the hospital. So I had to go back to that strong faculty and say, can our students work with these COVID positive patients? You decide. And the faculty, their faculty together, came back to me the next day and said, yes, we think they're ready. So we had a strong student body. We also had to make sure that it was voluntary. We made sure all those students, we got the nursing VP from the hospital, nurses on the site, and we made sure they understood it was voluntary. We didn't want any heroes. We wanted people to walk in there knowing that it was hard work, and the majority of our students are in the hospital today. So we are so proud of them. And then we worked a situation where they could be nursing techs at the hospital, so they get paid and they have faculty oversight. So it's a good combination. We began to teach off-site. That was very challenging for our faculty, but they're a wonderful faculty. And then I think the challenge is where we are today is a much different place than we were when we planned this response. We're beginning to see that this is not going to be over quickly. And I think that's the most difficult part for me. I'm ready for it to be over. I've responded to many emergencies in my career, things like hurricanes that come and go. And this is not going to come and go very quickly. So we have to strategically plan for the fall and the spring, our programs, working again with Kelly in simulation, working to see if we may be in there in the fall in the clinical sites, and it may be late in the year. Yesterday and today, we obtained permission for our student MP students and our nurse anesthetist students to work with the COVID patients. So they're going to go in the next couple of weeks. So we're making progress, and we're making progress not because they want students in there, because they know our students and they know our faculty and they're strong. I think the other piece of this, and Jennifer, I'm going to be handing it over to you, is so how do we take care of those students and how do we take care of those faculty? And Jennifer is leading Circles of Care, where we're not just putting them in there, but we're supporting them. And I'm so pleased at that program. So I'm going to turn it over to Jennifer to talk about that. Thank you.
Thank you. Thank you, Lorraine. And thank you, Ravina, Manisha, and all of our colleagues at the Columbia Global Centers, Mumbai, and greetings to all of my colleagues and friends who are participating in this webinar. Next slide, please. We are each other's harvest. We are each other's business. We are each other's magnitude and bond. This is from one of my most favorite poets in the United States. And more than ever, I think our magnitude and bond is critical in how we as a profession and as a humanity across the globe are going to respond and build a new society. Next slide, please. Historically, during pandemic responses, nurses have often been isolated, stigmatized, exhausted mentally, emotionally, because there have been no organized forums to speak with each other and get support. I witnessed this myself in my work during the HIV pandemic in sub-Saharan African countries, and also doing oral histories with nurses and midwives on the front line of the Ebola response in Sierra Leone, Liberia, Guinea, 2014 and 2016. And what this led to was burnout, post-traumatic stress disorder, reduced capacity to serve as frontline healthcare providers from lack of recognition and healing. So we introduced, the Dean and I, an initiative called Circles of Care, which is in a model to create an environment of healing where we can share experiences as a nurse responding to this pandemic. We talk, we listen, we acknowledge the challenges we face daily, and this is a way of not carrying that emotional burden from day to day. Next slide, please. Circles of care, healing traditions have existed in many cultures throughout centuries. This is a circle of care with Native Americans within the United States. Next slide. And this is what we're faced with now, using Zoom and trying to create an interconnection. This is me doing a circle of care with our nurse practitioner practice, which is now running a cough fever clinic to try and diagnose people and take the drain off of the emergency room. Next slide, please. So what happens during the circle? There's a welcome, there's agreements that are shared with everyone. One person signals when they want to speak, everyone else is on mute. We're mindful of time so that we can all share what we experience and share and listen. We treat each other with kindness and respect, giving full attention while someone is speaking. And this is a way of giving recognition, of saying, I see you, I hear you, I am there for you. And we honor each other's unique ways of healing. We don't presume to advise, fix, save one another. We do not dialogue between two people. If someone wants to remain in silence, that's respected as a form of healing. And we treat this as a safe space. So we do not quote and say so-and-so said so-and-so after the meeting. This is a place of silence, recognition, listening, hearing each other, and we end the circle with deep breaths. Next slide. So some feedback where we're doing this. We're doing it with all faculty at Columbia University who are in clinical practice, to our current nurses at the majority University Connected Hospital who are enrolled in an advanced course at our school, to the nursing techs that Dean Frazier referred to who are serving in a new clinical role, and to faculty and staff acting within our nurse practitioner practice, and to student council leaders. Next slide. And just to give you some results of what people said, on being with dying, I struggle when there are many people who have died and are left in their beds because the wait is so long for someone to transport the bodies to the morgue, and we have to walk around them. This feels so strange. I'm afraid to open the doors to rooms with COVID-19 patients because they may have died and died alone. I cannot connect to them to their families under these stressful times. In the last 4 shifts I have done, I have witnessed at least 10 people dying. On redeployment, I'm a postpartum nurse, and now I report to the ICU. I was taking care of a woman who was dying and trying to be there for her, and also hoping she would not die on my shift, as I do not know how to do post-mortem care. Then I felt so guilty afterwards. Next slide. And moments of hope come out of the circles. This circle is the first time I've let my feelings out. I'm able to contribute. I have a purpose. I'm so grateful for the camaraderie and teamwork of how we all work together. Doctors, nurses, techs, everyone is tired and stressed and scared and overwhelmed, but we are all in it together. And lastly, at first there were only constant sounds in the unit, sounds of crisis, the ambulance sirens, the calls for codes, the pleas for an anesthesiologist to help with an intubation. Now the hospital has added a chime when anyone is discharged home, a chime of victory. Behind our masks, we smile. So Kelly, tell us about our simulation work.
Good morning, everyone. I want to thank Ravina, Manisha, and Columbia Globals for having this webinar and all the participants that are joining us today. So as everyone said, I'm the director of the Simulation Center. So what I'm going to speak about is some of the changes that we made, and we had to make these changes fairly quickly to help not only our students, but also the hospital setting. So first I'm going to start out with some things that we did immediately to assist the burden in the hospital and also clinical practice. One of the immediate things that we knew that we could do is that as a simulation center, we had an abundance of equipment. And we knew in the hospitals that masks, gloves, hand sanitizers were going to be needed. So we went into our inventory, packed up all of the equipment, the PPE that we had, and we donated it to the hospital. That was one of the first things. And as you can see from these pictures, we gave away our N95 masks, our masks with shields, hand sanitizers, and most importantly, we had a ventilator that we were using for simulation, and we realized the need was greater in the hospital than it would be for us in the simulation center. So we donated our ventilator and also our anesthesia workstations because they could also use those to help ventilate patients that were suffering from COVID. Another one of the first steps that we took is that we got a call from the hospital that unfortunately, when you're dealing with COVID patients and there's a rapid response or there's a code, the way that we handle these patients had to be done differently because of the excessive exposure of COVID in the air during intubation, during bag and masking patients. We needed to develop a protocol that would minimize the risk to the healthcare providers, which meant changing the way that we respond to code situations. So although that's not my specialty, they needed simulation experts and people to help out. So one of the first things that we did was go to the hospital and work with the rapid response team to test out how do we handle these code situations in a different way that provides safety for our healthcare providers. So what I'm going to show you now is just a small little clip of how, for example, we don't, in the hospital, they don't bring the code card into the room. We have to keep it on the outside. We have someone that's designated just to see that the PPE is applied properly before someone enters the room. And you can see from this short video, there's a nurse who you see is actually checking first before that person goes into the room. So that was just one aspect of some of the changes that needed to be made. And again, simulation proved a wonderful way of testing this protocol. We learned, even though it was written out and approved, that by playing it out in simulation, we still needed to make other changes and adjustments. And this protocol was used throughout the hospital. Also, these are our wonderful nursing students. One of the ways that our simulation centers also assisted is we do have educators in our simulation center, and the hospital had an abundance of need for nurse educators because they could not handle all of the requests for redeployment of nurses, training of all the travel nurses that came in, all the new hires. So what we did is we offered to help out in the hospital to train certain individuals to help relieve the burden on the nurse educators. So one of them was that we went in and we helped educate our nursing students to get them prepared for the nurse technician role that Dean Frazier had spoke about earlier. And these are also some of our students who assisted with taking temperatures in the hospital. So I took a great picture of them working when I was going to do some training. So they checked everyone's temperature to make sure they didn't have a fever before they entered the practice. This is another training that we were called to assist with. And a lot of the nurses in the hospital were redeployed. And it's so weird for me to say redeploy because you think redeploy, I only hear that word when it comes to war. But it almost was like a war going on in the hospital. We had nurses from all different floors. And this particular training was for operating room nurses who were being redeployed to a medical surgical floor to take care of COVID patients. So you can imagine the fear of these OR nurses who, on a daily basis, they're not used to giving meds. They're not used to hanging IVs and even doing health assessment. They needed to kind of have a health assessment 101, which is what I was doing here in this picture, to help prepare them as quickly as possible so that they could now feel a little bit more comfortable working on this on the floors with the COVID-19 population. So very quickly, in a matter of less than a week, we were able to train 110 OR nurses so that they would be a little bit more comfortable working on their new floor. Another way that we assisted, because our simulation center has some educators and we are nurses and many of us are nurse practitioners, we also assisted at the faculty practice. So the faculty practice that was for primary care was converted into a fever and cough clinic. So at the center, we were testing people, particularly high-risk patients who were immunocompromised, oncology patients, and using the practice to now test these patients to see if they had COVID so that they can continue their treatment. And so we helped out with assisting with testing. We called patients, we followed up on patients. So that was something that we did early on at the faculty practice. And it was really eye-opening. We found quite a lot of patients not only suffering from cancer and other, disorders and transplant, but now on top of that, having the burden of having COVID. So really, we played a role in helping those patients. And then we were a part of a research study at that same practice. A few weeks later, we had the opportunity of helping out with a convalescent plasma study, which I'm sure you're hearing about in the news, where we would test people who have recovered to see if, number one, to make sure they no longer had the virus, and number two, we wanted to make sure they had enough antibodies. And what we did, the next step, if they had enough antibodies, or that they would go to the blood bank, donate their plasma, and that plasma could be used to save the lives of three people. So right now, this is a majority of the patients that we're seeing in the practice are these participants for the COVID plasma convalescent study. And I'm grateful to be there because I see the hope. I'm working with a pathologist who's leading the study, and it's threefold. They're going to take the plasma and not only give it to the critically ill patients in the hospital, but they're also using that plasma to help prevent healthcare providers from getting COVID. And lastly, the third population is they're looking at giving it to people who have been exposed to COVID in the hopes of preventing them from getting the virus. So a lot of us were there a couple times a week, very happy to be assisting in that manner. So that's what we've been doing as far as at the clinical practice and also at the hospital. So now I'm going to switch gears and talk about what are we doing for our students and what changes did we have to implement now that we're teaching virtually and now that our students are not able to come into the simulation center. And again, a lot of these changes had to occur very, very quickly. The first step was that we knew that some of our students were going to be working in the hospital, either as a nurse technician, or they were already working in the hospital as part of their job. So the first step was, let's make sure that our students have as much information as needed about infection control, particularly about donning PPE and doffing PPE. If they were going to be in a clinical setting, we wanted to make sure that even if we taught them that, we wanted to make sure we gave them a refresher. So the first thing we did is set up these online modules on PPE. And we were fortunate enough to have a world-renowned expert in the field of PPE, Amanda Hessel, come in and also give guest lectures to our students on COVID and standard precautions. And we also have weekly updates. So it's one thing to teach about donning and doffing, but we wanted to make sure that students were aware of any new updates, changes regarding COVID-19. So these are done via Zoom, and we've had students, we had great participation. We have about 30 students attend, particularly in the beginning each week. And we did it in the beginning about 3 times a week, and have slowly, as we see that our students, the need has gone down, we offer it about 1 time a week with updates. And we also, before COVID, we were part of a research grant where we were going to be implementing simulation in the hospital setting to improve standard precaution and hand hygiene in the hospital. So unfortunately, the research study is on pause, but we decided that we still can do something, particularly in our area. So what we did as part of our grant was to develop a toolkit for hospitals, for academic settings, for inpatient settings, on how can we take the protocols that we have in place for PPE and adjust that during this crisis. Because as you know, we're always taught in the beginning that you don't reuse your mask, that we only use a gown once and take it off when we go in and out of patients' rooms. And we quickly realized we don't have enough of that equipment to follow those standards the way they were laid out. So how do we adjust that in times of need, in times of crisis? So we developed a toolkit that is available for free, that we're going to be sending out probably, we're hoping later this week, if not next week, that gives people specific instructions, slides for students, notes, guidelines, and resources so that people can quickly change their protocols and implement these changes in this day and age of COVID. And most importantly, since we could no longer use our simulation center, we had to figure out how do we still provide those opportunities for students to come in and be able to assess a clinical situation, implement nursing or nurse practitioner tasks, and evaluate patients and diagnose patients, and also go into those rooms and provide that feedback to patients. That is a big part of our curriculum, and we realized we can no longer do that in the physical space. So what we had to do is to look at what's available online as far as screen-based simulation programs that could still provide students with that opportunity to perform assessments, to communicate with the patient, to review diagnostic labs, and also come up with a diagnosis. All of those components that we use as a nurse or as a nurse practitioner, but we had to do it in an online format. So as you can see here, this is an example of one of the programs that we're using called Oxford Health. So it's almost like a gaming situation. So through this online program, the students can still go in and perform a lot of those skills, just doing it screen-based with their mouse and their computer. They could still talk to the avatar on the screen, and that avatar will speak back to them. They can still figure out what assessments do they need to do. They can still see the vital signs, the labs. They can administer medications through this game. And then at the end, the most important part, it gives the students feedback. It lets them know how well that they performed. It lets them know the questions they asked, the questions they didn't ask, maybe some of the interventions that they should have done that they did not do. And it gives them a nice, clean rubric of how well they performed. And the nice part about these screen-based programs is they can do these over and over and over again. And they're pretty elaborate. They have cases for every single field, from OB to psychiatry to medical surgical, acute care, and even we have programs for our nurse anesthesia students. And one of the challenges was that there's so many programs out there, so we had to quickly review them and determine which programs, software programs, will fit our curriculum. And that could be different across our different disciplines. The one that we're using for the pediatric nurse practitioner may not be the same program we use for our nurse anesthesia students. So we had to set up these sample evaluations of these programs, get feedback from our faculty, and then make that decision on which program we wanted to use for our students. Another innovative way that we continued to provide our students with simulation opportunities was that we had a wealth of standardized patients who are actors that we had been using throughout our curriculum that we would train to portray a patient. And then the students would enter the room and take care of this standardized patient as if it was a real patient. And then we would evaluate the student's performance with that actor. So we realized that, okay, we could no longer do this in our simulation center, but we could still carry this out in the via Zoom, almost like a telehealth visit. So our students were able to log into Zoom and go in to see a patient, which was the actor that was in the comfort of their living room, and still be able to conduct those simulations. We realized that the missing piece was that these students weren't able to do the physical assessment, but there's ways around that also. We had students kind of walk us through what kind of physical assessment would you do. But all the other components, such as communication, such as, again, we made diagnostic tests that they had to look at and evaluate, to determining the diagnosis and speaking with the patient about their diagnosis and providing that health education. We were able to accomplish those outcomes using telehealth via our Zoom platform. Another creative way that we were able to provide simulation is through, again, using Zoom, and one of two ways. Our staff and our faculty in the simulation center are still able to be in the simulation center. However, our students cannot be in a simulation center. So one of the ways that we're using simulation is that we're going to stream live from our simulation room, and we as the sim educators will play the role of the nurse or the nurse practitioner. And we will have small groups of students who will be watching, and we'll let them guide us on what we should do next. So we may enter a room and the students see the vital signs. They can see that the patient has a low oxygen level. And then we turn to them and let them decide what are the next steps for us. And then we play those out for the students. So if they decide that the next step is that we put oxygen on, we'll go through and put oxygen on. And at another point during that simulation, we'll turn to them, let them discuss as a group what the next steps should be, so they get to practice that clinical decision-making skills. And then we will play it out in the simulation live. And then after that is done, we'll meet as a group and we'll have the typical debriefing that we always had during simulation to talk about what went well, and what we might have done differently. So that's one format of still continuing to use simulation, just in a different way. The other way that we can use a video conferencing software, and I say Zoom because that's what we have at Columbia, is that we can take one of the computer-based programs that we have, and we can also put that into Zoom and have the students do the same thing. We will, as a facilitator, just maneuver and make the decisions that the students come up with. So if we're in, again, that simulated environment, students will make the clinical decision on what the next steps would be. And as the facilitator, I will just carry those out. But all of the decisions, the interventions will be made by the students so that they can see it progress live through the Zoom platform. Before COVID, we were having these, what we call mini simulation courses. They were intense 1-hour sessions that were done in our simulation center on different topics that our faculty may not have had enough time to cover in didactic. So we pulled that out and made it an intense 1-hour session. Some of those had to do with rapid response, for example, verbal de-escalation, diabetes management. So we were able to still continue doing those sessions, but just, again, turning it into a virtual course and doing it online where students can see the presentation, make decisions, and then ask questions. So we still continue to have these once a week for our students that are, again, well attended. And one of the other areas that's hardest to accomplish virtually is that we knew our students, we were teaching them all these skills, and now they didn't have the opportunity to really practice those hands-on skills because they weren't able to come into the simulation center. Before COVID, we had during the week, we could have 3 different what we call open practice sessions where instructor that you see in the picture, Mary, would be staffed in the simulation center, and students can come in and practice any skill that they would like to practice under the supervision of a faculty. So we could watch them, give them guidance, let them know if they were performing it correctly. So we lost that availability of that during COVID. So what we decided to do, and again, it's not a perfect solution, but we still have virtual open practice. So again, the students log in, we have Mary in the simulation center, and we have all of our task trainers and our lab equipment, and the students can ask for the instructor to demonstrate certain skills. So although they're not able to do it themselves, there's still a benefit that can, from watching it being done properly and helping with maintaining some of the knowledge about how to perform that skill. So that's done about twice a week now. And again, we have certain skills that we have scheduled for each week, but the nice part is we also have students can request live any skill that they would like us to demonstrate. And so we talked about some of these screen-based software programs, which obviously come at a cost, but there are some free online resources. The one great thing about this pandemic is that a lot of companies have stepped up and know that we're in dire needs of some of these programs and offered them for free. One of them that we're using is from a company called Ryerson. And this is available. I have the website on the bottom. I'd be glad to share after this presentation. And they have great online simulations. Again, it's almost like a gaming format where you have to go through, they give you the clinical scenario, and you have to make the decision on what the next steps are. And based on your intervention, that's how the case evolves until the end where you get some feedback about your performance in that simulation. Another great one is by Medscape. And again, this is free. They have something called MedSims, and they have, I saw over 200 different cases that you can play out. And you also get CMEs. We don't use CMEs, but you get credit for each of these cases. So again, another great free online resource for students. And I also want to bring attention to our largest simulation bodies. We have the International Nursing Association for Clinical Simulation Learning, and NACSL. They have free access to a lot of virtual learning resources right on their website. You do not have to be a member to access these resources, but they have ways to teach you how to teach webinars on how to teach virtually. They have, again, a list of different resources for simulation, screen-based simulation, webinars. Today I'm going to be attending a webinar on even how to clean your simulation center. So when we do go back, we have to do things differently. So I think that's a great resource if you can log on to there and see a lot of things that will help in the academic setting. In addition, Society for Simulation in Healthcare is another organization that's interdisciplinary that also has been providing resources for educators, hospital staff on COVID-related simulations resources. And one other thing that we've been doing is that because we are the epicenter of COVID, we're learning a lot. We've done some great things and handled things very well, and there's also lessons to be learned. So one of the things that, that I think it's useful for us is that we can provide guidance to other states, other countries on how we've been dealing with COVID, like having this informational webinar. So we've been doing a lot of webinars, talks. We had one for company Wolters Kluwer on simulation and other strategies to replace clinical hours for student progression and graduation, because we know that we're all in the same boat. We're all trying to figure out how do we do things differently and get the students to meet their outcomes so that they can graduate and become nurses. And that webinar, we had over 1,300 attendees on that webinar. So we know that there's a need. We also have virtual town hall. I'm a member of an organization that had 2 town halls where people can call in, and we hear from nurses on the front line. And it's important for us to get our message out so people can hear what we're going through. What are our needs? How can people support us? We've been able to raise funds so that we can buy PPE for nurses on the front line. So, and also we've been very lucky to have some of our elected officials hearing about what we're going through, because they're the ones that are going to make the laws, the bills that are going to help us in the future with everything from, you know, hazardous pay to getting equipment that we need, to getting bills passed to help students, nursing students in particular, with getting their loans decreased because of the ability to help on the front line. So again, we want to make sure that people hear from us so that can help us in the future. And again, using radio, news, we've been doing videos and posting those online just to, again, educate the public community about what our needs are, and again, what it's like being on that front line. So in closing, I just want to talk about some of the things to consider in the future. Again, although we're going through it, we don't have all the answers. We're still working it out also. But some of the things that we know that we need to really think about is, how do we change our curriculum to, to accommodate virtual learning? How do we choose the programs when there's so many on the market? How do we choose which ones will work for our program? What are the new regulations, precautions that we're going to have to take as we move forward? Because I don't think we're going to go back to how things were. Are we going to have students practicing social distancing? Will students have to wear masks when they come into the classroom or the simulation center? How are we going to clean the rooms in between students? These are all new things that we have to think about. We also have to look at, if we have regulations on how many hours our students need, how are we going to meet those hours if we've been a semester without having our students in clinical? Are we going to go back to our regulating bodies to ask them what adjustments can be made, since we're, again, lost this prime opportunity for our students to be in the clinical setting? And we talked about cleaning, again, for the simulation center classroom. And lastly, we have to figure out, how do we obtain the resources. And resources, I mean, it could be the money to pay for these software programs, which can be costly if we're paying a license for every student. How do we pay for all of the PPE that we're going to need for our students if they come back and we say that they need to wear masks or gloves? So just figuring out ways that we can find the funding to support this new way of educating our students. And lastly, I just wanted to just provide my contact information. And again, I'm looking forward to being able to share the toolkit in the near future. And I'll make sure that I give that information to Ravina and Manisha so they can distribute that to our participants on this webinar. And that's all I have.
Thank you, Professor Dawn and Professor Brian, and to Manisha for moderating. That was very moving, and it was also very informative and innovative in how we can think through the business of education and teaching and caring. And yet it was very humbling to listen to you all and to the other people in this nursing profession and nursing education field who are joining us today. It's been wonderful to have you and to start this conversation. I know that you are very committed to a global dialogue as you are in your own community. And we hope that this will be the start of such a dialogue. In some places it may have started, in some places it hasn't. And to whatever level of intervention we can make at the Columbia Global Centers, we are happy to connect the incredible work that's happening at QSON in the other medical areas, for people who are caring for patients with COVID-19, with the rest of the communities in different parts of the globe that are doing the same. For those of you who are interested, please, in learning more, please go on to the website of QSON, which is the Columbia University School of Nursing, and you can get a lot of information out there, and you can be in contact in that manner. You can also reach out to us and we can put you in touch. Thank you everybody for joining us and being part of this very amazing experience. Bye-bye.